Welcome back. So Senegal has shut its borders with Guinea. Reports on social media say visas for Guinea and Liberia pilgrims have been halted by the Saudi Arabian government. Reports have it that Senegalese trying to get home are stranded at the borders on the Guinean side, even staying in their cars for some, while traders express their worry over how long their goods will be able to last if they can't get home. At this point, I want to talk to Benoit and get you into the conversation because I want to know what this means. With shutting of borders, obviously it's going to affect the economy of countries, different countries that, do business together. So what does this mean to the country that is suffering the most from this outbreak? Guinea.
Guinea, for example, yeah.
That's definitely one of the concerns, obviously. Limiting the trade in between countries, limiting entries and goods coming out of the country is going to have an impact. It's difficult to know exactly now how it's going to impact the cities, but it will have an impact. We're monitoring this. We're doing assessments on the prices of the goods on the markets to try to react quickly if ever there was a big increase, because obviously the population won't be able to afford any increase because they're already very poor. So this is definitely something we're monitoring very closely.
Now, coming back home here in Nigeria, there's been some scare on social media that the virus has found its way to Nigeria, to Abuja. In fact, I'm going to read a couple of tweets here, and this one comes from Deji, and it says, the Ebola virus has not been confirmed in Nigeria, but the nomadic nature of Nigerians makes education about it necessary. How would you react to that? Do you think it's a thought?
Well, certainly, since we have human-to-human transmission, and the world now is becoming a very global village. You can have somebody who wakes up in Accra today, is in Lagos by 12 noon, is in Guinea by 2 p.m. You see, we can actually move. And the one thing you just need is for one person to contract it. And if he moves to 3 countries within that short period, he can spread it all over. So it is good for us to make sure we contain that outbreak within that area, make sure that we correct or treat it within that area so that it doesn't go on a wider scale. By the time it goes on a wider scale, then we have an epidemic in our hands.
Let me ask you, Doctor, what exactly is the lifespan of this virus? Because the reason why I'm asking this is, some of the worries that we have on social media, it seems that, first of all, the virus can't die, and disinfecting it can only, make it inactive. Now, for example, let's say as an average Guinean or a Liberian, I have a neighbor who rears pigs, and obviously some of the pigs are infected, and my neighbor comes to my house, sits on my couch, sweats on my couch, and I get to now. How do I control that? Even when I disinfect my house with sodium hypochlorite or something, there's still that fear that the virus is still waiting for a host. So how long can this virus survive when it's outside its habitat, so to speak?
Well, sincerely, most like I've told you, viruses are both non-living and living.
Yeah.
But the truth about it is that you must have the living being transmitted to another living being. Okay. So that is why when you say you have body fluid, if the body fluid is dried for quite a long time, it makes the virus ineffective. Okay. But
not
if
dead.
it is, yes, certainly, but sincerely, it's not as if that we have had a body fluid of someone who died from Ebola on a desk, and you expect to still see it in another 5-10 years. No, it will be ineffective. It cannot get transmitted to another person. But viruses, as they are, they have a period in which they can stay within the human being. And within those periods is that time that all the body parts, all the function of the body may be affected. If one can survive through that period, that person will live. Okay.
Okay.
And that is the important thing we have to know about virus.
Doctor, 5 out of 6
yes
would die. why didn't the sixth person die?
Yeah, it means there is
And
some
why
chance
haven't
of
we
recovery.
studied what is making that,
That
you know?
six to be alive.
So we have 90%, so there's 10%.
The highest case fatality ratio that I've been seeing is 90%.
So we have 10%.
We have some places in which it is up to 56, that it is lower
Than
to
in
that
others.
level. It depends on the immunity and a lot of things. Okay, the virus that affect human being has different ways of infecting, and what it means is that if I don't want to go technical, there are so many sites that the viruses must have a composite receptor on the human body.
All right.
I may have 5, you may have 3, somebody may have 2.
So to
okay, so
understand
for it to be very effective and have this fatality, maybe the one who
So
has
saying
5.
it differs from individual to individual.
Yes,
Okay,
yes.
Krishna, I know earlier we talked about children dying, and you said, you know, the virus is no respect of gender, but we haven't really gotten figures. Do you have figures of number of children that have died? I know there are a lot of mothers out there that are probably wondering, oh my God.
No, we do not have statistics or figures of how many children have died. But we also need to remember, please remember that this spreads very quickly when people come into contact with each other. For example, big marketplaces, you know, where they have fair and big accumulation of people. So that's where schools are very important. That's where a large number of children come together and possible children-to-children infection can take place. But at the same time, schools also provide a great opportunity to strengthen public health measures, including key messages on hygiene promotion as well as other public health measures.
Okay, but so even though we don't have figures, we know that some places are already shutting down schools, although I know that the government has said that they should open back the schools. So do you think it's wise to do that? Because I can imagine with children, they don't really know how not to touch each other and play and, you know, have fun.
It's difficult for parents to control their
How do you
movement.
get kids to cooperate in keeping themselves safe? So don't you think maybe shutting down schools would be a better and safer option, Doctor?
Well, sincerely, I think it's based on the government of the land. You see, those who are on the field are saying that there are a lot of confusion, there are a lot of misinformation. But if you have to contain this disease, you must be able to quarantine people so that those who are infected may not have close contact.
Okay.
It's like when someone is having this common cold, which majorly is also a viral disease. By the time someone has common cold and gets into a midst of people, many people around that person may contact that cold. Okay. So it is, you can see how easy it can be. If you have a child who has Ebola and he just sneezes and you have all the droplets dropping on second person, third person, that person gets home within 2-3 days or 1 week, he sneezes at home, the whole family, and we have those in another school, they go, you can see the way the widespread can be like a wildfire. Okay. So the government really needs to put things in place to make sure that people are well protected. And we must be able to take care, especially for the adults, why you have it majorly in the adult, is that those who died. You see, we have this affection that this is my person who died, you touch him, you wash him, you may have a cut, some of the body fluid coming from such person. Those people who washes them are very, very having a high risk of contracting it.
All right, let me hold you there. Mr. Krishnan, let me come to you. Now, where you are in Guinea, what is the nature of the, awareness campaign, towards women and children, on this virus?
I think that's perhaps the most important question. What's happening is the messages of public health is being spread through various measures today. It's not like the 1976 or the early 1980s when Ebola became more known to the world, where health workers had to go to villages and often they came in direct contact with infected people, they themselves getting infected. That's not the world we live in today. Thanks to technology like mobile phones, radios, television and other sources, it's easy to get the messages across even to some of the most rural areas where phone connections and internet penetration plus television and radios can reach out. So plan's focus has been mostly to strengthen public health messages, to relay it using various sources, including text messages and other channels.
Okay, I can imagine that an awareness campaign can only be successful if both the party that is creating the awareness and the party receiving the awareness work together. I'll address this to Benoit. How are people responding to the awareness campaign? So when you go out and say this and this and this are things we advise you to do, how are people receiving that?
People are usually receiving it very well. I mean, the people we're using, the volunteers we're using to run these campaigns are people coming from the communities. So they know the communities very well because they're from them. So people listen to them. But again, as I mentioned earlier, there's a big stigmatization around Ebola. So it's not easy, and the message needs to be repeated and repeated again. So people listen, but it's still, it's not a one-off shot that you need to do. It's a constant discussion with the communities.
And how about the government? How helpful is the government being at the moment?
We're working very well with the Ministry of Health. We're working with all other organizations like MSF. I think everybody's on board. As I said before, this is the first Ebola outbreak in Guinea. So, everybody is adapting to the situation and responding as quickly as possible.
One question I'm sure everybody's probably wanting to ask is, can this virus be contained at the moment? We've seen this reoccur time and time again since 1976, so in different places. So can it be contained at the moment?
Certainly it can be contained if...
when?
How?
How?
When?
Well, we have found that we have agreed, as it is today, that there is no cure. And we have agreed that you have to have human-to-human contact for you to transmit that, for the disease to be transmitted. By the time you can quarantine, isolate those people who are affected, and make them to run through the course, treat them, give them supportive treatment, because one of the major causes of death is dehydration from diarrhea, vomiting. You treat them, some of them will recover, and those who unfortunately do not recover, you do the proper burial rites, and at the end of the day, once this group of people have been taken care of, it will be contained.
Okay, but Benoit, your final words regarding everything we've been talking about, especially reassuring me that this outbreak will not reoccur.
Well, my final word is that hopefully we soon will contain the disease. I mean, we're really scaling up now. We've got more and more people on the ground to try to trace all the people that could be infected. I think we need everybody together to work on that. We need to take that very seriously. There's no need to panic for anyone, but this is a serious outbreak.
Okay, thank you very much, Benoit.
We need to all work together to try to find a very quick end to this.
Okay, so Krishnan, your final words.
Yes, this is not a lost case. Remember, it is possible to save lives by taking appropriate preventive measures. So take this seriously. Collective action, which involves the government, non-governmental organizations, Red Cross, agencies such as Plan and others. That's the second thing. And the third thing, provide support. That is, international community should provide both technical support as well as other resources to the affected countries to fight the virus and stop its spread.
Thank you very much.
There is a role for everyone to play, and it's a big issue that needs collective action.
Certainly. So everybody's agreeing here that we need collective action to get this done. Thank you all for being a part of this show.
Yeah, but just
we could go on the social media. Okay.
Before we go, I know we couldn't read all the tweets, but don't forget to continue the conversation online. It doesn't end here. And it's just a quick acronym that we came up with on our own. You know, as far as the preventive measures are concerned, it's called DCP, disinfection and cleaning, contact and proper burial. Now, disinfection, if for example, if you get to clean your house or disinfect your house once a week, please do that
properly,
every day now.
And then the next one?
Many times as possible. And of course, contact, for those of you who go out to do your groceries, buy fruits, or you need to clean your animals.
Proper care.
Where you must have at least a pair or two of gloves, you know, in doing all this. And of course, a proper burial for those who might have lost their loved ones and they need to bury their loved ones.
Certainly.
Please do that promptly and safely.
Thank you once again, Dr. Francis. We could go on, but we have to stop right now. Remember, the conversation doesn't end here because it continues online. Keep those tweets coming. Goodbye.